Dear students, welcome back. In this session, we are going to discuss about interferential therapy. Okay, so I have already explained about interferential currents in the therapeutic currents. Now, in this session, we are going to discuss about how the therapy is given by these interferential currents. Okay, and what are the indications, what are the indications, what are the physiological effects of the interferential therapy. Okay, so the interferential therapy is a form of electrical treatment in which two medium frequency currents are used to produce low frequency effect. Okay, so already we have low frequency currents. Why this medium frequency are used means the main problem which is associated with the direct application of Faradic or sinusoidal currents to patients is the very high skin resistance or impedance. So these resistance, the skin resistance, will not allow such low frequency currents. Why? Because it is having a physics rule that skin resistance, that is Z, which is equal to 1 by 2 pi Fc, where Z is the skin resistance. Okay, where Z is the skin resistance here, and then F is the frequency in hertz and capacitance of skin in microfarads. Okay, so here we are applying over the skin. That means the capacitance of the skin will not change. Only the changes may occur in the resistance as well as the frequency. That means these two are inversely proportional. So the skin resistance Z is inversely proportional to the frequency. If skin resistance is more, means the frequency is very low. If we apply more frequency, then automatically the skin resistance is going to reduce. What we are doing in interferential therapy, we are using medium frequency currents. What is the range of medium frequency currents? That is, which is greater than 1 kilohertz, that means 1000 hertz, to less than 10,000 kilohertz. Okay, sorry, 10 kilohertz or 10,000 hertz. Okay, so here the range of these medium frequencies in this peak, we are using 5000 hertz, which is a medium frequency, and here 4950. This one is also medium frequency currents. That means these currents will easily transmit through the skin layers. Why? Because if the frequency is more, then the resistance of the skin is less. Okay, when these currents are passed, we'll get a beat frequency called, which produce a low frequency current. So this low frequency current will have the physiological effects which are same as that of the Faradic type, but the patient is more comfortable in this type of interferential currents. Okay, yes, so this is about the interferential therapy, why we are using medium frequency currents. So this medium frequency currents of around 4000 while able to stimulate motor and sensory nerves, which encounter a much more skin resistance. Okay, so the low frequency currents which are produced by these type of two medium currents is ranging from 1 to 250 hertz. Okay, and also the main principle which is involved in the interferential therapy is based on that which produces the interference effect, where two medium frequencies currents cross in the patient's tissues. So that is the principle. So that means here when the two medium frequency currents cross in the patient's tissue, which produces an interference effect, So that is the principle which is involved in interferential therapy. So that interference effect is known as the beat frequency. Okay. Yes. So one of the currents is kept in constant in out of these two circuits, and out of these two types of currents, one of the current is kept in constant. For example, 5000 is kept in constant, and other can be varied between 4900 to 4950, 4900 to 5000 in between. Okay, an interference effect at a beat frequency is equal to the difference in frequency between the two currents which is produced in the tissue at the point where these two currents are going to cross. For example, the first circuit is having 5000, okay, and the next circuit is having 4950. Okay, then if you see the difference, so once these two medium frequency currents crosses, then we will get a beat frequency of 50 hertz here. Okay, by varying the frequency of the second circuit relative to the constant frequency of the first, it is possible to produce a range of beat frequencies deep in the patient's tissues. For example, if the circuit A is carried a current with a frequency of the circuit is having A is having 4950, and the other one is having circuit is having 5000 hertz, isn't it? So we'll get the beat frequency of 50. If you change any one of these circuits, so if you take this one as 4900, then you will get the beat frequency of 100 hertz. Okay, so and also a sophistication for this technique is to allow a frequency swing in which a rhythmical progression is made through the full range of beat frequencies. If a rhythmical range of 0 to 100 hertz is required, this is achieving by varying the frequency in the second circuit, that is between 4900 and 4000 hertz over a period of 5 to 10 seconds. If you maintain 100 hertz difference, then we can have to produce a rhythmical range of 0 to 100 hertz. Okay, so 4 electrodes are used in 2 pairs, each pair being indicated by the coloring of the wire from the machine. The electrodes of each pair or placed diagonally, okay, diagonally opposite one another in such a way that the interference effect or beat frequency is produced in the tissues where it is required. For example, in a tissue, this is the area where the effect is produced. You have to arrange the electrodes in such a way that the beat frequency or the interference effect which is produced in that area, okay, which may be very deep. Okay, variations in the interference frequencies can be pre-selected on the machine and may be constant or rhythmic. We can use a constant mode or a rhythmic mode. A rhythmic mode indicates that the frequency is swinging continuously from the lower to the higher value and back. So the frequency scales usually available are 1 to 100 hertz, which is constant mode, where any particular fixed frequency can be chosen. So you can choose any type. So up to 1 to 100 means you can choose 1 to 50 or 1 to 20. So that is constant. If you choose 1 to 20, throughout the treatment 1 to 20 hertz is used. Okay, like that the frequency you can choose. But the same kind of frequency is always constant throughout the treatment. And also you can choose rhythmic type. In the rhythmic type, that is it is having different types, that is 1 to 10 hertz rhythmic. That means in rhythmic type I have explained that from 1 to 10 it slowly increases the frequency to the maximum and again back down, and lower to the from lower to the higher value and again back from higher to lower. So that is called as rhythmic. So this can be used in such a way that 1 to 10 hertz, even 1 to 100 hertz, 80 to 100 hertz. You can select such kind of rhythms, and also 1 to 25 hertz rhythmic type according to the condition. Okay. On some units, the frequency of the two circuits is such that a beat frequency of 150 hertz can be produced, and this 150 hertz claim that this frequency is very useful in pain modulation. Here the pain modulation is done through the pain gate mechanism as well as the descending pain suppression pathway. The same as TENS. Here if you can use 150 hertz, which is useful in pain modulation. Okay, so this is all about interferential therapy, and now we will move on to the physiological effects of the interference currents. So the physiological effects vary with such factors, and it mainly depends upon the magnitude of the current, type of the mode used, whether we use rhythmic or constant, and the frequency range used, and accuracy of electrode positions. So all these factors affect the physiological effects of the interference currents. So now, what are the physiological effects of the interference currents? One is the pain relief. Pain may be relieved very effectively using interferential therapy, and a number of mechanisms what we have discussed earlier in TENS, the same type are used for pain relief. And there is an increase in local circulation which may be produced by either the local pumping effect of the stimulated muscles or the effect on the autonomic nerves, and therefore blood vessels may help remove chemicals from the area which are stimulating nociceptors. Short duration pulses at frequency of 100 Hz may stimulate large diameter nerve fibers, which will have an effect on the pain gate in the posterior horn and inhibit transmission of small diameter nociceptive traffic. And also a frequency of 80 to 100 hertz. 80 to 100 hertz. Okay. Rhythmic is useful. 80 to 100 hertz. Rhythmic is usually chosen for the effect as the problem of accommodation is reduced. Okay. So 100 hertz, which may stimulate the large diameter fibers which have effect on the pain gate in the posterior horn. That means it is going to suppress the or inhibit the transmission of small diameter nociceptive traffic. Okay. And if you activate the descending pain suppression system, a frequency of 15 Hz is required, and the stimulation of small diameter fibers produced will eventually cause the release of endogenous opiates like enkephalins and beta endorphins at the spinal level. Okay, so you people know that. So this endorphins, how it is getting means the nociceptive stimulus which are carried by the small diameter fibers, which finally reaches to the cortex. From the cortex it sent back through the descending suppression pathway, where here the raphe nucleus and PAG, which is present in the midbrain, which carries the impulses, and a synapses at the spinal cord level at the substantia gelatinosa, where it releases the enkephalins and beta endorphins, which blocks the substance P production. Okay, so this is carried out by this enkephalins. And also physiological blocking of nerve transmission is also explained as a mechanism of pain modulation produced by interferential. Okay, and also it is thought that the maximum frequency of transmission in C nerve fibers is 15 Hz, and for A delta fibers, so A delta fibers is 40 Hz. Okay, the application of frequencies higher than this maximum could block transmission along these fibers altogether. Okay, so and such kind of frequencies which are mainly used to reduce acute pain and the chronic pain syndromes. Okay, this is about pain relief. And muscle stimulation. Normal innervated muscles will be made to contract if interferential frequencies are between 1 to 100 Hz are used. The type of contraction depends on the frequency of stimulation, as the shape and length of each individual stimulus is of a muscle stimulating type. So that stimulus should be the muscle stimulating type. Okay, at low frequencies a twitch is produced between 5 and 20 Hz, which leads to a partial tetany. Okay, and from 30 to 100 Hz it produces a tetanic type of contraction. Okay, a complete range of all these types of muscle contraction can be seen when a rhythmical frequency of 1 to 100 Hz is used. Okay, muscle contraction is produced with little sensory stimulation and can be of deeply placed muscles. For example, pelvic floor muscles. Okay, next one is it also helps in the increased local blood flow. That means so at the placement of the electrodes and also at the area of the beat frequency area, so at that area which increases the local which causes the vasodilatation of the capillaries, which induces the blood increased local blood flow. Okay, next one is the reduction of edema, and this can be accelerated by the frequency of 1 to 10 Hz rhythmic. 10 Hz rhythmic is used to reduce edema. Okay, so as it is a rhythmical pumping action is produced by muscle contraction, and there is possibly an effect on the autonomic nerves which can affect the diameter of the blood vessels and therefore the circulation. So both of these factors will help absorb the exudate which causes the swelling. So once this exudates or absorbed, and finally which leads to reducing swelling. So these are all the physiological effects of the interference currents. And next we'll move on to the indications, contraindications and dangers of the interferential therapy. So indications, the main indications are the pain. So the pain is reduced by different mechanisms, okay, like pain gate and descending suppression pain pathway, and also the edema can be reduced by using interferential currents. So when there is edema, you can use IFT. And when there is stress incontinence, so normally the person is unable to hold urine because of the weakness of the muscles, which leads to stress incontinence. So the stress incontinence can be treated with the help of IFT by stimulating the pelvic floor muscles. Okay, so these are the indications for the IFT. Okay, so if you see this in the treatment of stress incontinence, it is possible by placing the electrodes on the lower abdomen and inner thigh to produce a good strong contraction of the pelvic floor. This may be far more comfortable than Faradic stimulation using an internal vaginal or rectal electrode. Contraindications are same as for any low frequency treatment. Okay, so what are the contraindications? Now we'll see. One is the hemorrhage. So skin infection, malignancy, pacemakers, deep vein thrombosis, pregnancy, cardiac problems, and epiphyseal region in children, and also TB. Okay. So hemorrhage, already the site of injury which is producing the hemorrhage, that means oozing of the blood. If you apply interferential currents in that area, so which produce the contraction of both skeletal as well as the smooth muscles, which may enhance the bleeding. So in such condition you should avoid IFT. Skin infections, like any other current stimulations, IFT may cause concentration of currents in the infected lesions as well as may lead to spread of infections. Hence, it should be avoided. Malignancy, so as there is a possibility of accelerating metastasis, it should not be applied in such conditions. And if you see the pacemakers, so some people is having a fear of interferential currents affecting the functioning of a pacemaker. It should be avoided over the region of anterior and posterior chest. Okay. Deep vein thrombosis, as the enhanced circulation produced may break the thrombus leading to embolism. It should be avoided in deep vein thrombosis. Okay, so once this thrombosis leads to embolism, these emboli may travel in the blood, may circulate in the blood, and may block any area in the body. If it blocks in the blood supply of the brain, which leads to paralysis. Okay, so for that reason we should take the history properly, whether the person is having deep vein thrombosis or not. Okay, and then pregnancy. So in the pregnancy also we should not give interferential currents. So as there is a fear that this current may damage the fetus, development of the fetus, so it should not be applied over the low back and pelvis in the pregnant ladies. And if the person is having any cardiac problems, also we should not give. Okay, and also epiphyseal region in the children, at that region we should not give IFT. And this tuberculosis also we should not give. So there may be not only in lungs, TB, spine, like that. You should not give at that areas, which also causes spreading of this TB to the other areas. So in TB also IFT is contraindicated. So these are the contraindications related to IFT. Coming to the dangers, the only real damage is that of an electrical burn. If a bare electrode touches the skin, or if the electrodes on the skin are too close, allowing a skin current to pass between them rather than through the deeper tissues. Okay. And also sometimes it may cause increased pain. So as a rule, the patient is expected to get the sensation of mild tingling type, but if the intensity is too high, or if the electrodes are placed close to each other, or if the bare electrodes touch the skin, the patient may get pain. So both are similarly related, both burns and increased pain. So both will have a common reason. Okay, these are all about the interferential therapy. Thank you.